The views expressed on the Jerry Cahill CF podcast are that of Jerry Cahill and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing on the Jerry Cahill CF podcast should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Jerry Cahill and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to the Jerry Cahill CF podcast presented by the Boomer Esiason Foundation and jerrycahill.com.
Welcome to Jerry Cahill's Living, Breathing, Succeeding podcast series. This show, transitioning from pediatric to adult CF care from a parent's perspective, has been made possible with financial support from Mylan to the Boomer Esiason Foundation. Today you will meet Eileen Charles. Eileen is a creative marketing writer and event planner for nonprofits, small businesses, and major brands. She is a dedicated advocate and fundraiser for the Cystic Fibrosis Foundation. Eileen has a passion for theater, serves on the advisory council of Engard Arts in New York City, and is VP Board of Directors of Clock Tower Players Community Theater in Irvington, New York. Eileen lives in Hastings-on-Hudson, New York, with her husband, architectural photographer Frederick Charles, and their youngest son, Timothy, age 16. She is most proud of recently launching her twins, Clara with cystic fibrosis and Ian on their college journeys.
Hi, I'm Eileen Charles. I live in Hastings-on-Hudson. I'm a freelance creative marketing writer, and I live with my husband Fred and my 3 children, Clara, Ian, and Timothy. Clara, who's in college now, has cystic fibrosis, and she's doing well under the care of her adult CF team. So I actually found out that Clara had cystic fibrosis when I was pregnant with Clara and her twin brother. I had gone for some genetic testing, and the doctor put cystic fibrosis on the list of things to be tested for, and I said, why? And she said, just do it. And they said, if you don't hear from us in 3 weeks, everything's fine. 3 weeks later, I got a phone call saying that I was a carrier of cystic fibrosis. And then they asked for my husband to come in and take a test, and he took a test. And I said to him, we found each other because he was also a carrier of the gene. And then there was a 1 in 4 chance that one of the babies would, or both of the babies would be affected. Turns out baby A, which was Clara, was affected, and her twin brother is not even a carrier. It was devastating to find out as I was pregnant. We were so joyful about the pregnancy. We decided not to tell our family because we wanted to continue the joy and then go with what's to come. And when Clara was born, she was beautiful, and so was her twin brother. And we hit the ground running, really, in her health care, and we were able to learn everything we had to learn and help her stay on the right track. And it was, of course, we had fear and we were worried, but finding out early was the best thing for us and for Clara. Life at home with Clara, we would incorporate her CF treatments in our daily lives, inviting her friends over to watch TV while she did it. We would sing songs, play games. Everything seemed to be going fine, and then she got an infection at age 2, where she was in the hospital for a couple of weeks, and then she came out again, and not till age 5 she had another episode, but that was a little more serious. Part of her lung had collapsed and took a little more care, but she ended up pulling through that beautifully and coming home and started singing and dancing and doing her theater. I wasn't expecting Clara to transition at age 18. We were at her pediatric visit, and at the end of the visit, her doctor said that she was retiring. And then we had some options. So of course, when your doctor retires or moves on after caring for your child for a number of years, that's another change that you have to think about. And so our options were either to stay with pediatrics till Clara was 21 and have another doctor who she assured us she'd be in good hands, or moving to the adult center now. Initially, Clara wasn't ready to change. But then as the summer went on, she decided that, well, since my doctor's retiring, maybe it's time for me to move on to the adult center and just get familiar with them before I go off to college. I like to think about transitioning as my daughter moving up from the pediatric center to the adult care center. With that, there have been a lot of fears and anxiety about letting go and having her manage her care on her own. But I think by working together as a family, keeping our lines of communication open and working with our care team, it's proven to be a pretty successful process. Moving up means learning and growing and taking the next step in your life and in your health. And as our children mature and grow, that's really our responsibility to help them get there. So moving up to a CF Adult Center is a real positive thing. It's helping them learn to manage their care, and which means that we have to take a little step back, which can be scary, but something that as a parent I'm learning to manage and deal with, and slowly, step by step. I found it was a gradual transition from pediatric care to adult care all throughout Clara's younger years. Her care team would teach her how to take her enzymes and then tell her to help mommy clean the nebulizer. So really be familiar with the steps that she had to do to maintain her health. So that gives them some prep for when it's time to be independent. I think our initial response to walking in the front door of the adult care center was, wow, no screaming children all around. It was quiet, it was open, it was modern, and the reception was waiting for us. And it seemed like a very personal experience, more so than at the pediatric center where there are so many families waiting in the waiting room. At one of our first visits, we were running a little bit late. So I dropped Clara off in front of the door, and then I went around the block to the parking lot, which took me another 10 or 15 minutes. So we're used to waiting and waiting to see the pediatric doctors, so I just thought I would be perfectly on time and Clara would still be in the waiting room. Well, she texted me and said, "I'm done." And I didn't even get to go in and hear anything. So that was total loss of control as a parent. And from now on, I make sure we're on time so I get to at least pop my head in and talk to somebody. I think one of the hardest things for me was knowing that eventually I'm not going to be in the meetings with Clara, because I always knew the right questions to ask from my observations of her health, if she's taking her meds, if she's not. And the hardest thing for me is to trust that she, as an adult now, she knows her health better than anyone, and that she's going to communicate that to the doctor and make sure she gets the right care. Communication is key, and I think what I try to do with Clara is just give little reminders, and that's still me trying to want to control or influence the situation, but I think they're helpful because what I noticed is that, your young adult is nervous about the transition as well, and they have to be assured that they're not being totally severed from you and your care. That's all part of the growing process. And a big factor for our family is communication, and that's something we always try to do. I try to do that with each of my children. Whether it's Ian at college or Timmy in high school or Clara, we just try to be open and share how we're feeling with each other and touch base with each other and help each other as best as we can. Overall, I'm very happy with the transition. After meeting with the new team a couple of times, very confident in the care that Clara is getting. I think between all of us, it's a great support system, and that's the positive side of moving up.